This is an update for October 2021. We're coming to the end of our fourth week of vaccinating our 12 to 17-year-old and pregnant and breastfeeding patients with Pfizer vaccinations. ATAGI has today issued advice recommending a third primary vaccination for our patients who are immunosuppressed between 2 and 6 months following their second dose. This is not technically a booster dose, but a third primary vaccination. Specifically, this group includes transplant patients, patients with malignancy, on chemotherapy, on high-dose prednisone, immune suppressants, or biologics. We'll start vaccinating these patients from next week, and we have adequate Pfizer vaccinations in stock to do this. Pfizer's the preferred vaccination for this purpose. We're bound by our COVID-safe policy, requiring adequate social distancing and cleaning protocols, obviously, and we're doing telehealth appointments as a default, apart from COVID and childhood vaccinations. So when an examination is required, the patient will be invited in for an examination and obviously won't be charged out of pocket twice for this service. Our GPs are skilled at issuing e-pathology requests, e-prescriptions, emailing referrals, and in some cases issuing e-radiology requests where the radiology provider offers that service. A good quality high-resolution photograph emailed to our reception team available at the time of your consultation is an extremely helpful way, in addition to a video consultation, to very closely resemble a regular in-practice consultation, but with the convenience of not having to leave home or work. We also get to see each other's faces without masks. On the subject of COVID vaccination, we're now getting two questions. Primarily, when will our primary school-aged children be able to be vaccinated? And what about boosters? We understand that Pfizer has successfully completed phase 3 trials with primary school-aged children aged 5 to 11 with a much smaller dose of the vaccine, about a third, and is in the process of requesting approval from the FDA to administer the vaccine to the broader community. So from an Australian perspective, watch this space. Presumably there'll be a request for TGA approval in the not too distant future. On the subject of boosters, it's now been 6 months since our frontline healthcare workers and border workers were vaccinated, and our 70 and 80-year-olds vaccinated soon after that. And the question on everybody's lips is about boosters, when and what. We're expecting advice from ATAGI imminently on that subject. I hope this update's been helpful.